So, you're expecting. First off, congratulations, that is huge news. And of course, right on the heels of all that excitement comes a pretty big decision, finding the right doctor to guide you through this incredible journey.
So, where do you even begin? I mean, the question itself can feel totally overwhelming, can it? You're not just looking for a doctor with the right qualifications, you're looking for a partner, someone you can truly trust with one of the most important experiences of your entire life.
And let's just be real for a second. You're probably feeling a little bit of everything right now. You're excited, maybe a little nervous, and definitely dealing with some uncertainty. That is 100% normal. Our goal here today is to help you turn that uncertainty into confidence.
And the best way to build that confidence is with a solid plan. So we've broken it all down into a really simple 4-step framework. Think of this as our roadmap. We're going to go from figuring out your own personal health needs all the way to nailing down those final practical details.
Okay, let's dive in. First up is step 1, knowing your needs. And this really starts with 2 things: understanding the different types of prenatal care providers out there, and then figuring out where you fit in based on your own health profile.
Let's break down your main options, because you got a few. First, you have OB-GYNs. These are medical doctors who can handle both low-risk and high-risk pregnancies, and importantly, they can perform C-sections. Then you've got certified nurse midwives, or CNMs. They specialize in healthy, low-risk pregnancies. And finally, for the most complex cases, there are maternal fetal medicine specialists, or MFMs. These are OB-GYNs who've done an extra 3 years of super specialized training.
So, how do you choose between them? Well, it all starts with taking an honest look at your personal health to figure out what your level of risk might be. This, right here, is the key question you need to ask yourself, because understanding this is going to immediately help you narrow down what kind of provider and what level of care you should be looking for from the get-go. So, what exactly puts a pregnancy into that high-risk category? Well, it can be a number of things. Stuff like pre-existing conditions, say diabetes or high blood pressure, or if you're over 35 with your first baby. It also includes expecting multiples, twins or triplets, or if you've had complications in a previous pregnancy. If any of these sound familiar, you'll probably want to start your search looking at an OB/GYN or maybe even an MFM specialist.
All right, moving on to step 2, vetting the provider. So once you know the type of provider you need, it's time to start researching specific individuals. And here, we're going to focus on 2 really key areas: their credentials and their philosophy of care. Okay, before you do anything else, you need to verify their license and their professional record. Every single licensed doctor in the country is regulated by a state medical board. These boards are your official source for checking that a doctor's license is active and, crucially, to see if they have any disciplinary actions on their record. And you know what? The easiest way to do this is with a free national database called DocInfo. It's run by the Federation of State Medical Boards, and you can look up any doctor and see their entire license and disciplinary history across all 50 states. It's an absolutely essential step for your peace of mind.
Okay, so their credentials check out. That's the baseline. That's non-negotiable. Now comes the part that is just as important, making sure their approach to birth actually aligns with yours. This is all about finding the right fit, about compatibility and trust.
And listen, don't be shy about asking some very direct questions. Ask about their C-section rates. What are their personal views on inducing labor or on epidurals? How do they support patients who are hoping for an unmedicated birth? You can even ask about newer options, like something called a gentle C-section, which tries to make the surgical experience feel more personal. The way they answer will tell you a whole lot. And now, for step 3, evaluate the hospital. Because here's the thing. Even the most amazing doctor is still working within a larger system, and the quality of the hospital where they actually deliver babies is just as critical to your safety and your whole experience. The place really, really matters.
So, how do you even begin to judge a hospital? Well, the good news is you don't have to guess. There are independent, data-driven organizations like the Leapfrog Group and U.S. News and World Report that do all the heavy lifting for you. They analyze hospitals on key maternity care factors like C-section rates and safety records. And the differences they find? They're not small. They're actually staggering. According to U.S. News, hospitals that they recognize as being the best for maternity care have C-section rates that, on average, 22% lower than hospitals that don't get recognized. And look at this. The data on newborn safety is even more dramatic.
Those same top-rated hospitals have rates of severe, unexpected newborn complications that are a whopping 44% lower. I mean, this is why evaluating the hospital is an absolutely non-negotiable step.
Now, beyond those general ratings, there's another crucial thing to look for, especially if you're in that high-risk category. It's the hospital's official level of maternal care. This is a standardized system that ranks a facility's ability to handle the most serious complications that can come up.
And the difference is, well, it's night and day. A level 1 facility is great, but it's really just equipped for straightforward, low-risk births. A level 4 center, on the other hand, is a different world. It has MFM specialists and a full ICU on-site 24/7, ready to manage the most critical emergencies. Understanding this difference is just vital.
All right, we've made it to our final step, Step 4. Confirm the logistics. You've done the hard research on quality and philosophy. Now it's time to nail down the practical stuff that can make or break your experience, both emotionally and financially.
Think of this as your final logistical checklist. Of course, you're going to check if your provider is in your insurance network. But don't stop there. Is the hospital also in-network? What about the anesthesiologists or the neonatal units? Verifying that the entire care chain is covered can literally save you from thousands of dollars in surprise bills. And you should also ask about practical things, like what's their policy for after-hours calls?
Now, this might be the most important logistical question of all, and it's one a lot of people just forget to ask. You spend months building this great relationship with your doctor during all your prenatal visits, but are they actually going to be the one there for the main event?
And the reality is, probably not. The vast majority of OB-GYNs work in group practices, and they rotate who is on call at the hospital. This means the doctor who actually delivers your baby will most likely be whichever partner is on duty when you happen to go into labor. It's so important to know this up front so you can make a point to meet the other doctors in the practice and just manage your own expectations.
So, what is all this about? The paperwork, the research, asking all these tough questions? What's the point? Well, it's all working towards this one simple goal. You're not just looking for a service provider. You're trying to find a trusted partner, to build a team that will foster a collaborative partnership, one that prioritizes the safety and, just as importantly, the dignity of your birthing experience. That's what making a good choice really empowers you to do.